the question that is very related to the topic that you just touched. What would you start? And maybe I would ask a question in a different way. If your main goal at the club, or I don't know, even in private practice, was to prevent the groin injuries, what would it be? What kind of scenario strategy would you offer to the club players so that they can prevent the groin injuries even when they are young? So I mean, what's your approach to the young athletes, and what is your advice where they should seek the solution so that they won't have the problem in the groin area in their later career?
Well, it's a little complex question, because at the moment we do not have a clear picture of all the risk factors which are responsible for somebody to have such a problem. For example, we know that there are different types of risk factors. Some are extrinsic, that they are related to the environment that you participate in, and some are intrinsic, which are related to the person itself, to the player itself. So we know that if we have an athlete who is exposed, who has some intrinsic risk factors, who is exposed to the situation that involves the mechanism of injury, that is more susceptible to get an injury. Mm-hmm. So from that perspective, it would be most advantageous for us to know which risk factors can we see on the body and react early. So for the adductor problem, as an acute injury, we know that the weakness of the adductor muscles and the imbalance between the adductor and abductor muscles of the hip are a risk factor for future injury. So what we can do, especially in the young players, we can screen them to see if this is an area where they have a weakness. The second risk factor, which is in the literature recognized as a significant, is the total range of motion in the hip in rotation. So if we combine the internal and external rotation, so this total range of motion, if it's restricted, it increases the risk of future injury. In terms of prevention, it means that what we want a player who has a good ability to produce strength and good ability to produce movement in the hip, not only in the rotation, but also in all other areas. So for this, we do have pretty decent evidence in the literature. There is also area of stability of the lumbar pelvic area, which is rather complex because in the literature there is no clear definition about it. But in practice, you do see that the players who are unstable during single leg movements are more prone to such problems.
Mm-hmm. Coming back to football, because you've got a huge background and huge experience in that. You used to work with many players, top elite players.
I still do.
You still do, as far as I know, and we had a chat yesterday during our road back from airport. You are currently taking care of a few players from the top leagues in Europe, including Benfica Lisbon, Wolverhampton, and as you said, Celtic Glasgow. Also, there was from there. So
several players they are still young players. They are still developing, so they are not at the top of performance, but they choose, from my point of view, a right path, and that is the path to go into the career very, very slowly until they reach the top level. And what is specific for them is that I have a long-standing collaboration with them. I know them pretty well, and they are very motivated to get better. Mm-hmm. So from that perspective, I said it would be a shame to stop this collaboration just because somebody is, 800 kilometers away from you.
Of course.
So I decided to devote a certain amount of my professional time to continue to work with this player.